Welcome back to Dateline Schools. On our segment today, we're talking with Dr. Annette Mercatante, the director of the St. Clair County Health Department. And joining us on this segment from Marine City is Justine Springborn, a young mother who has a unique story to tell, and we were anxious to tell that. But before we get to your story, Justine, at the end of the first segment, Dr. Mercatante, you were talking about pertussis and how that's kind of coming back in our area. What is pertussis?
Pertussis is a disease that's caused by bacteria. It's commonly called whooping cough. And whooping cough is a particularly serious disease in infants. It causes an infection on the airways that narrows the airway, and as a result, they have difficulty breathing. They cough so hard that they can't breathe and vomit. And we know that infants in particular suffer the strongest. Now, whooping cough is a vaccine-preventable disease, and for many years we didn't see much of it. But lately, the rates of pertussis have doubled. California currently has a declared epidemic. Here in Michigan, we are struggling with a great increase in cases, including here in St. Clair County. Our cases have doubled in the last 2 years.
And Justine, I know this whole scenario really had a major impact on your life and your family's life. Tell us a little bit about your story.
Well, I had twin boys in November, and in February, Colin became very, very ill. He was, coughing, rattly chest, just every day got worse and worse with his symptoms, and after a week, he ended up passing away.
That's just so sad.
Yeah.
And they found out that it was from pertussis?
Yeah. We didn't find out until my other son, his twin, got infected also. We found out when he was in the hospital. Corbin was in the hospital, and he tested positive for pertussis because they knew there was one death. His brother died before, and he tested positive, and then they sent a lung culture to Washington, D.C. to confirm that that's what Colin died from.
Wow.
Yeah.
Any idea how Colin contracted that?
The first people they looked at was me and Dan, because they say they pick it up from, most of the time, their parents. But we weren't sick and we weren't coughing, so they say that they probably got it through passing with someone that did have it.
Okay. Now, you had both boys immunized, though, right?
Yes. They weren't fully immunized because they didn't get all of their doses, but they did get their first dose.
So this is a case of a young family where you did everything right, but yet something went terribly wrong.
Right.
Wow. Dr. Mercatante, from a healthcare provider's standpoint, what can we do to prevent something like that happening again?
Well, there's two levels here, and one is as far as the individual patient. I hope that everyone who is suffering or knows someone who's suffering from a severe cough, that they think of pertussis, because we need people to think about it to properly diagnose it. The second issue is that no vaccine is 100% effective, and we know that our babies are the most susceptible. The reason why this is happening more is because the vaccines you and I received tend to become weakened over time, and we have an adult population now that is circulating this germ. That's why we looked at Justine and the father to see if they were the ones that carried this germ to their babies, because we know most of the time it's the adults. But the adults don't get so sick that they need to go see the doctor, so they just cough and then they get better, and by then it's gone. We need something called herd immunity in this community. We need the adults to boost up their immune system so this germ doesn't have a chance to circulate.
And Justine, I mean, with such a tragedy, and I don't know how well you can sit here and tell your story, but what is your message to parents?
My message would definitely be to anyone that's providing child care for your child, make sure you get them, make sure they are up to date with their shot, they've gotten their booster. Anyone that's around or in contact with your child, make sure they're up to date. Also, if you have any questions at all or are nervous about anything, you have to clear it up with your doctor, pediatrician, or anything to get more information and learn more about it, so that you know that it's actually more harmful to get pertussis than to get the vaccine.
I mean, as much as you hate to see your children crying and the minute pain that they have, I mean, for this a short time, but it's definitely well worth it, isn't it?
Yes.
How's your son Corbin doing now?
He's doing excellent. He's now 9 months and crawling and getting extremely big on me. So we were battling it for about 3 months. He was about sick and he was on an apnea monitor, and they just took him off of it, and he's just now in the clear and is healthy.
And don't expect any side effects or anything as he grows older?
Not yet, not as we can see now, no.
Dr. Mercatante, is this one of those diseases that if you do get it, you can cure it?
There is a treatment available, and because it is a bacteria, antibiotics can work. But even though you can treat the germ, the coughing and the symptoms can persist for a long time. And as Justine is describing with Corbin, even though he was properly treated in the hospital, he suffered from recurrent bouts of severe coughing and problems related to his breathing for many, many months. And that is very typical of pertussis.
Now, how different is pertussis from, say, other coughing diseases, breathing diseases like, say, croup and some of those other ones that young children have a tendency to get as they're developing?
Well, for one thing, it's more severe and more deadly. And although croup is probably more common, it's caused by a virus that typically is self-limiting, we call it. So in other words, if you just support the child with breathing treatments and things to make them more comfortable, the virus is finally taken care of by the body's immune system naturally, and they get better. Pertussis won't just spontaneously go away with supportive care. It continues and continues and gets worse and worse.
So are there any specific symptoms a parent needs to look for?
The hallmark really is the persistent cough. It's that cough that just won't go away, particularly if the child's coughing to the point of vomiting or having difficulty breathing.
And Justine, I know, and we're really grateful that you're here and to share your story here on Dateline Schools with us, but I also know you have some other opportunities to share your story too. Tell us a little bit about that.
Well, the Times Herald contacted me and they're doing an article, and also I am attending a press conference in East Lansing, and it's regarding sixth graders kids going into sixth grade get their pertussis shots, and yeah, they're going to have an immunologist come and talk, and then they're going to introduce me, and I'm going to tell my story. So
I'm grateful to see that you're willing at least to try to help other people and really make a real positive out of this tragedy.
Yeah, I just would hate for something like this to happen to anybody else.
Great. And Dr. Mercatante, I know the health department's been putting together a lot of information, and you guys are a wealth of information on things like that. Where can parents get more information, not just on Justine's story, but on this whole situation with pertussis?
Please contact us. Whatever questions you may have, fears, concerns, we'd be more than happy to discuss them with you. We have all the information you could possibly want for any vaccine that's available.
And where can parents get that information? Do you have a website? Or
a St. Clair County website for the health department, or you can call us at 987-5300.
And my guess is the Center for Disease Control has taken this, not only our matter here locally, but what you mentioned in California and elsewhere around the country, they're taking it pretty serious, aren't they? Justine
is actually going to be part of a group of parents. Unfortunately, she's not alone. We lose children every year to vaccine-preventable diseases, and their voices need to be heard. The risks of these diseases far outweigh any risk of the vaccine, and hopefully their stories will get that message across.
Great. Justine, any last-minute advice you'd like to give parents who may be watching tonight?
My advice is to definitely research. If you have any questions or anything, talk to your pediatrician and clear the air about vaccines and the harm that the diseases can actually do. Ladies, I just want to thank you so much for coming on the program. Justine, thank you for sharing your story and your willingness to share that with the public so it doesn't happen to another family. And Dr. Mercatante, it's always great having you on the show, sharing healthcare issues here in St. Clair County. And we want to thank you so much for joining us in this edition of Dateline Schools.